Hello everyone, welcome to Midi Cuisine. Today we are going to talk about tremors, a very important general medicine topic, tremors. In this lecture, we will talk about the different types of tremors, the different medical conditions which result in tremors. So what is meant by tremor? By definition, it is an involuntary oscillatory movement of a body part. It is a kind of shaky movements of a body part. Moving on to the types of tremors, there are two major types of tremors, the resting tremors and action tremors. These are the two main types of tremors. Resting tremors occur when a body part is completely relaxed, or we can simply say resting tremors are those that occur at rest. It means that when a body part is completely relaxed, or we can also say that when a body part is completely supported against the gravity, these tremors tend to occur. And these resting tremors can be stopped by deliberately moving that affected body part. When a body part is experiencing resting tremor, when you move that body part, when you try to move that body part, the resting tremors stop. The action tremors occur with voluntary body movements, voluntary muscle contraction. And we have got few different types of action tremors. The first type is kinetic tremor. The first type is kinetic tremor. The second type is postural tremor. The third type is isometric tremor. And the last type is functional tremor. So let's talk about the kinetic tremors. Kinetic tremors occur when you are doing a goal-directed activity, like when reaching for something with your arm. When you try to reach for something with your arm, this is actually a goal-directed activity. For example, if I ask you to touch your tip of nose with your arm, so this will be a goal-directed activity for you. This, if you experience tremors of your hand in that very situation, these tremors will be called kinetic tremors because these occur when you are doing a goal-directed activity. The kinetic tremors are again of two types, simple kinetic tremors and intentional tremors. Simple kinetic tremors are those that remain constant throughout the action. When you are doing a goal-directed activity and the tremors remain constant throughout the action. If the tremors worsen near the target, as I said, if I ask you to touch your tip of nose with your hand, with your finger, and you start to do it, when you're near the tip of the nose, the tremors appear. These will be called intentional tremors. When you are near the target, when you are doing a goal-directed activity, and during doing that goal-directed activity, when you reach near the target, the intentional tremors occur. They're present, but they worsen when you become near to the target. So these are intentional tremors. The postural tremors occur when you hold a body part against gravity. When a body part is exposed to the force of gravity, these tremors occur. For example, if you hold your arm in front of you, and the hand and the arm experiences tremors, these will be called postural tremors. The third type is isometric tremor. Isometric tremors occur when you contract muscle against unmoving object, like when you try to push against a wall, your muscles contract against the unmoving wall. So at that time, if your arms experience tremors, these will be called isometric tremors. And functional tremors have got all the features from all the different types of tremors. If you have got Resting tremor, if you have got kinetic tremor along with postural tremors or mixture of all these types of tremors, they are called functional tremors. The classical example of functional tremor is psychogenic tremors. Psychogenic tremors are functional tremors which have got all the types of tremors, a mixture of all the types of tremors actually, we can say. Now let's talk about the causes of different types of tremors. So first of all, we will talk about the resting tremors. Resting tremors typically occur in Parkinson's disease, which is regarded the most common cause of resting tremors. So the most common cause of resting tremors is Parkinson's disease. The typical disease of resting tremors is Parkinson's disease. However, these can also occur in Wilson disease. Wilson disease, a genetic disease where there is defective metabolism of copper. Copper starts depositing in central nervous system, and this Wilson disease can manifest in different movement disorders actually. So Wilson disease can cause resting tremors. The Holmes tremor, also called rubral tremors, are midbrain tremors because they occur due to damage to the midbrain region of the brain. They can also present as resting tremors. But remember, the classical disease of resting tremors is Parkinson's disease. Parkinson's disease. If you hear about resting tremors, think of Parkinson's disease. But along with Parkinson's disease, don't forget the Wilson disease, the rubral tremors, they can also present as resting tremors. Essential tremor. Let's talk about essential tremor, which is a very important topic in this lecture. Essential tremor was previously called as benign essential tremor, familial essential tremor actually. So the first thing you should know about essential tremor is action tremor. Essential tremor cannot present as resting tremor. So essential tremor can present as postural tremor or intentional tremor. The classical essential tremors, they're postural tremors, or they can be is intentional tremor. Essential tremors usually involve arms and hands. Some patients have head shaking, and they are always bilateral. Always bilateral. Essential tremor has genetic predisposition, and it is inherited as autosomal dominant fashion. So if father is affected, there is 50% chance then the son will be affected. A classical feature of essential tremor is its amelioration with alcohol. When you give alcohol to a patient who is experiencing essential tremors, these essential tremors will relieved. They will ameliorate, and they are classically worsened by caffeine and beta blockers. Essential tremors affect the skills of persons, like the writing skill is classically affected, and the person tends to write very large, called macrographia. Remember, we have talked about micrographia in our previous lectures. Micrographia classically occurs in Parkinson's disease due to bradykinesia, and macrographia classically occurs due to essential tremors. The person tends to write very large. As I said, essential tremors affect the fine skills of person. Like writing, the person tends to write very large, and it is called macrographia. Otherwise, disability is limited. There is no such disability due to essential tremor. The person can take care of himself or herself. And sometimes essential tremors are confused with Parkinson's disease. Most of the time, it is very easy to differentiate the tremor of Parkinson's disease from essential tremor, because in Parkinson's disease, the tremor is also accompanied by other neurological features like rigidity, like postural instability, and bradykinesia. But sometimes the tremor tends to be the most dominant feature of Parkinson's disease for many years. In that case, it becomes difficult to differentiate the tremor of Parkinson's disease from essential tremor, but still you can differentiate these two. The most important feature through which you can differentiate essential tremor from the tremor of Parkinson's disease is essential tremor is always action tremor, maybe postural type or intentional type, but always action. While the tremor of Parkinson's disease tend to be a resting type, the famous pill rolling tremor. Don't forget that pill rolling tremor. The pill rolling tremor. Don't forget that pill rolling tremor, typical for Parkinson's disease. You can also differentiate essential tremor from the tremor of Parkinson's disease by looking at the family history, which is positive, which is usually positive in case of essential tremor. And one more thing by which you can differentiate these two types of tremors is by looking to the response to alcohol. Actually, the essential tremors are relieved by taking alcohol, while alcohol is no effect on the tremor associated with Parkinson's disease. So by this method, you can differentiate confidently the essential tremor from the tremor of Parkinson's disease. Now let's talk about the treatment of essential tremor, how we actually treat it. We can treat essential tremor with propranolol, and alternatives to propranolol include alprazolam, clozapine, and if the medical treatment fails, we have a surgical option, the thalamotomy. Now let's talk briefly about what is physiological tremor. Physiological tremor occurs in normal persons due to increased sympathetic activity, and they are mainly of postural type, the postural tremors. So physiological tremor occurs in normal persons due to increased sympathetic activity, mainly of postural type. So this was a brief discussion of different types of tremors and the different conditions that actually caused tremors, different types of tremors. I hope you understand well. If you have any question, comment it down. Thank you.